Hello, I just wanted to come on and do a quick video. I've had quite a few questions about my postnatal assessments, and they're all very similar questions, so I thought I'd come on and do a little bit of a video because it's a really good question. So a lot of people are asking me, I don't have any pelvic floor dysfunction, can I still benefit from a postnatal assessment? So in short, the answer is yes. Every woman and every mother on this earth can benefit from a postnatal women's health assessment. It really is so beneficial, and it's so important. So as women's health physios, we treat pelvic floor dysfunction, but we're really passionate about actually preventing pelvic floor dysfunction happening in the first place, and that can actually be done via a pelvic floor or by a postnatal assessment. And the reason why we advise it postnatally, there's loads of reasons, but we're on the back of it. There's a lot of research that's suggesting things like the risk factors. So pregnancy and birth are huge risk factors for developing pelvic floor dysfunction down the line. So what we want to do is get you seen early and ensure your pelvic floor is functioning correctly, ensure it's activating well, so that we can prevent you developing dysfunction down the line. So if you don't have pelvic floor dysfunction postnatally, that does not mean you're not going to develop pelvic floor dysfunction down the line, unfortunately, as well. In fact, I often see women who are having, leakage during running. They've finally gone back to exercise year on, and they've started leaking, and they're not sure why, and they retreat from exercise, and actually they didn't have any problems prior to that. So it doesn't necessarily mean that you're not going to develop these problems. And there is a couple of reasons for that. Again, we see a lot of women in menopause who have been completely asymptomatic, so haven't had any symptoms since they've had a baby. And that's due to your pelvic floor. It's in the estrogen within the pelvic floor. So your pelvic floor is very, very estrogen receptive. So it relies heavily on a lot of estrogen to maintain its things like muscle bulk and muscle density, and basically creating a really good, nice, functional pelvic floor muscle group. And what that actually means is very good at masking weakness. So our pelvic floor can be quite good at masking weakness because of that. So there's properties within estrogen that their role is to help the pelvic floor regain its shape in return after birth. So obviously that's all the role of estrogen. So when women down the line hit menopause and those estrogen levels drop, all of a sudden that masking of weakness is unveiled, and the weakness can kind of become apparent. I do treat women all the time with menopause, and they say, look, I've had 3 babies. I delivered them naturally, no tears, and I never had any problems. Why am I leaking now? Why have I got a prolapse? And what did I do wrong all of a sudden? And it quite often I have to explain it's not necessarily that you've done anything wrong. Right now it's perhaps when I explain the fact that perhaps there was just some weakness that was masked there, and perhaps your pelvic floor was never really switched back on and was never really functioning as optimally as it could. And that just slight drop in estrogen started to make it become a little bit, and obviously the muscle structure, the kind of properties of your muscles change in menopause, but that's a different video. We'll come on to that another time. Postnatal. So birth is just quite an exhausting run for your body, if you like. It really is. If we think of all the things that we endure rehab with, so knee ops, hip ops, we should be doing that for birth, because it's arguably what a lot of professionals say, it's quite a trauma for the body. It is. There's micro trauma to all the fibers in the pelvic floor muscles. They stretch and contract to get that baby out. So, and often when that happens to the body, again, like hip and knee surgery, muscles can switch off a bit. So we want to fire them back up again and get them switched on, and that's kind of what we do. But like I say, it's really key to get those switched back on. And again, if you've had any trauma in birth, so any birth injuries, tears, episiotomies, your chances of developing pelvic floor dysfunction go up. And if even things like 3rd and 4th degree tears, and there's a small percentage of the population who experience therefore to be tears, and their prevalence of pelvic floor dysfunction is even higher. So if you're not experiencing symptoms but you have had trauma during delivery, I definitely advise that you get a postnatal assessment, because you're gonna really benefit from that. So yeah, so definitely book in. Every woman benefits from it. In fact, every woman who gets one, they're always like, oh, I just feel so much better. It's about prioritizing that healing body and that healing phase after pregnancy and birth, which is really important to me. I'm on a bit of a mission, if I'm going to be honest, to make sure that as women, our health and well-being is prioritized, especially in the phase of life where we birth life, we give life. That should be prioritized. It really should. And there's countries in Europe, so France, for instance, every woman who's given birth, they get a women's health assessment by a women's health pelvic floor physio assessment postnatally, and their prevalence of incontinence and prolapse is way lower than the UK. So it points to really what we should be doing. So yeah, I hope that's kind of answered the question, which is in short, yes. So book in. If you're pregnant, if you know any pregnant mamas, tag them below. Buy one for your postnatal, for your mammy friend, your new mammy friend. The most amazing thing you could buy her is a checkup for her body and bits. It really is. Babies get everything, all the clothes, all the toys, and I often see mums in clinic. And there's a kind of sigh of relief when we do the assessment and we chat through everything and we look at where they want to be, their recovery phase, any problems they have, and if they don't have any problems, we get all sorts of education. They get the information that women who I see in menopause say, I wish I got that postnatally. So every woman should get this information. And I'm really passionate about getting it to all women. But yeah, so they often say, no one asks about my body, and sometimes they're honest and say it feels a bit wreck and ruin, and we're here for that. We're here to support that. It's been through a lot, so it really is important. And your pelvic floor is connected to everything, to so much. It really is. Your pelvic floor is so responsible for so much function, which is a different video, because I'm running out of time. I want to keep this short. But I do passion rant. So it's connected to your diaphragm, so it influences your breathing, which influences your posture. So the pelvic floor is part of your posture, as part of your core. So again, hence why it can influence your posture. And then all these things can affect our ability, our function, our ability to do in things like exercise and stuff like that. So we really do tailor it. We do tailor it for the woman who's in front of me. Whether that's looking at breastfeeding and breastfeeding postures, or whether that's addressing the goals to get a woman back to running, because that's really what her nourishment is, and it feeds her to go running, and she really wants to get back to that. Or maybe I'm looking at we're working out a bit of a treatment plan for a woman who's got a lot of scar tissue there from an episiotomy. She's got some pain during sex. Sexual health is a big thing we look at as well, really important, and unfortunately primary care systems aren't as informed as they perhaps could be about the role we do play in sexual dysfunctions and things like pain and during sex. Nobody's to blame, it's just people aren't really aware of us. So yes, I'm going to stop blabbering. Book in your postnatal assessment. If you're pregnant from 6 weeks onwards, we can book it in. It's never too late. I am developing vouchers for women for a baby shower idea. Okay, this is a great idea, right? I would have loved it. So your friend's got a baby shower, pull together and get her a postnatal assessment, all right? That would be amazing. So get in touch if you want them. And thanks for listening.